Hello, and welcome to my Applied Research Project presentation and partial fulfillment of the requirements for the degree Doctor of Athletic Training at Arizona School of Health Services, A.T. Still University. This is Michelle Brozowski, and the topic of my quality improvement project was developing a plan to implement an electronic medical record system at the Spence School. Throughout this process, I was advised by Dr. Barton Anderson. First, let's address the problem. Quality patient care should be driven by high-quality patient care documentation. Documentation should provide an explanation of the individual's complete medical history, including all subjective and objective information, along with serving to measure the quality of services that the healthcare professional is providing. The ability to define the patient's and practice patterns of athletic trainers providing care in the secondary school is fundamental to any efforts aimed at improving patient care, enhancing clinical practice, and expanding employment opportunities in this unique and important employment setting. These goals are accomplished through quality documentation. Communication among all healthcare providers, whether it be the athletic trainer and nurse in a secondary school setting, or physician and his colleague in a healthcare facility, is imperative to quality patient care documentation. Detailing of patient encounters and services facilitates better patient management and allows for more precise documentation of services provided. Having up-to-date and accurate medical documentation will highlight a patient's progress and treatment effectiveness while helping to share relevant medical information with each provider through recall of the information recorded. At the Spence School, communication and sharing of medical records needed to be more streamlined between the athletic training and nursing departments so that both parties could have access to each other's information regarding the student and athlete's medical accounts. Therefore, the intention of this quality improvement project was to develop a plan to identify and implement a new electronic medical record system at the Spence School to facilitate higher quality and more complete medical information documentation and to enable better communication between the athletic training and nursing departments. The Spence School is an all-girls kindergarten to grade 12 independent college preparatory school in Manhattan, New York. The current enrollment is 752 students, of which 265 are in the lower school, 227 in the middle school, and 260 in the upper school. The athletic department consists of 3 individuals, the athletic director, her assistant athletic director / assistant athletic trainer, and a head athletic trainer. There are approximately 280 student athletes that participate in 30 sports from grade 5 to the varsity level. Our nursing department consists of a lower school nurse at our 93rd Street location and a middle upper school nurse at our 91st Street location. There are 4 primary guidelines that an athletic trainer should follow for proper documentation according to the NATA Best Practice Guidelines for Athletic Training Documentation. These 4 guidelines are professional responsibility, quality patient care, improved communication, and legal responsibilities. Professional responsibility is the responsibility of all healthcare professionals, including athletic trainers, to make sure that they are abiding by the federal and state regulations set forth for the documentation of medical information for the respective profession. Each state has their own practice acts and regulations that healthcare professionals must abide by, while federal laws such as the Health Insurance Portability and Accountability Act, HIPAA, and Federal Education Rights and Privacy Act, FERPA, were set up to keep an individual's personal, health, and academic records confidential. FERPA applies to all agencies that receive some form of monetary assistance from the Department of Education. This includes public schools, private schools, and most post-secondary institutions. Some private and all religious schools at the elementary and secondary level do not receive funds from the department, so they are not subject to FERPA laws. The Spence School, however, even though private, is subject to FERPA laws. Quality patient care can be driven by high-quality patient care documentation. By documenting a patient's care from initial evaluation to discharge, including all subjective and objective information, helps a clinician ensure that they are following the standard of care set forth by professional and state guidelines. Along with subjective and objective information, the reasons as to why the clinician chose to use one particular treatment option over another helps set a standard of care. Quality patient care documentation can help in the development of specific treatment plans that allow for proper clinical decisions when shared among different providers. This sharing of information can highlight the patient's progress and help in the clinical characterization of its practice while evaluating the effectiveness of the treatment protocols being performed. Communication between the clinician and patient is also imperative. Sharing of short and long-term goals and the expected outcomes of the treatment protocols are all benefits of thorough medical documentation. According to McLeod et al., reference number 3, more than 1.4 million sports-related injuries occur each year in interscholastic sports. With all these injuries occurring, it is imperative for the healthcare professional to document all injuries to help avoid litigation in the case of a malpractice lawsuit. Proper documentation should consist of all patient care executed from onset of injury and treatments performed to discharge. In the event of a lawsuit, proper documentation allows for the healthcare professional to have the ability to look back at the written notes and remember the facts of the case. By having a comprehensive report of all care provided, optimal risk management can be supported. As healthcare professionals, finding the appropriate method of using and sharing of health information for the improvement of quality and delivery of care is crucial. Through the use of an EMR documentation system, this sharing of information can be accomplished. Currently at the Spence School, there is no standardized system for medical record keeping in place. In the athletic training department, the core AT EMR system has been used, but not to its fullest potential. Initially, documentation was entered into the system on a daily basis, but as time went by, daily documentation within the system diminished. The primary reason this system hasn't been utilized is time management and lack of training of all staff members. The head athletic trainer was the only individual trained on how to fully utilize the system, and taking time to log into the system and filling out the corresponding documentation takes needed time away that the athletic trainer can be treating the student athletes. The other two athletic trainers, the assistant and per diem, who are evaluating and treating the student athletes, are not inputting information, and here is where complete documentation is getting lost. As for time management, it is much easier to just quickly write down who was seen for the day on a daily treatment log and by filling out the rehabilitation report, which in actuality can be accomplished while working with the student athlete. It is much more time consuming to have to log into a computer system and fill out the required information, which must be done outside the treating of the athlete. The nursing department, which is comprised of two different individuals, primarily uses paper files to store the student medical records. These records include physicals, medical notes, and prescriptions from doctors, among other pertinent information. The lower school nurse does use her own injury report that she has stored on her computer, but the upper middle school nurse still uses paper and pencil for all her medical documentation. Communication between these two departments primarily occurs through email or a phone call. Unfortunately, the upper and middle school nurse uses this mode of communication within the athletic training department approximately 50% of the time upon sending home an athlete due to illness or injury that occurred while in school. This often leads to confusion when it comes to games and practices when an athlete who was thought to be in school that day does not show up for participation. Since medical information documentation is a necessary part of all healthcare professionals' scope of practice, communication between the athletic training and nursing departments needed to be more efficient, and both parties needed to have access to each other's students' and athletes' medical records. A process flow chart, Figure 1, and cause and effect diagram, Figure 2, were created to show the process of how the current system of medical documentation is performed and how the proposed plan of developing and implementing an EMR system would benefit the institution. The PDSA Plan, Do, Study, Act cycle supported the design of the proposed implementation of the EMR system at the expense school. The initial planning of how to develop the plan to implement this system began with identifying the problem that existed. Figure 1 shows the process of the current paper documentation system versus the use of an EMR system. You can see how much easier and efficient the EMR system is in relation to using a paper system. Figure 2 represents the who, what, and how the spend school benefits from the implementation of a new EMR system. Who is involved with the change, what procedure and policies are simplified and streamlined, and how the environment is impacted by this adoption of a new system. By using the concept of the PDSA cycle that turns ideas into actions, the plan of change is to develop a strategy to implement an EMR system that can be used by the athletic training and nursing departments. The benefits of adding the EMR system for both the athletic training and nursing departments include allowing the sharing of complete and comprehensive health information, allowing for quick access to student medical records in a more efficient way, improving communication between the departments, and providing enhanced privacy and security of patient records. Deciding the appropriate path to take to reach the goals of planning and development of the plan of action began with research. The various EMR systems available for athletic trainers and healthcare professionals were researched, including Prezia Sports, Sportswear, and the athletic training system. After reviewing all the different features available, which can be seen in Table 1, the best system that would fit within the parameters of the needs of the spend school is that of the ATS system. This injury tracking system allows for the athletic trainer to record, manage, and report athletic training information, collect data for preseason and in-season, and has the ability to share pertinent information with coaches. This system meets both HIPAA and FERPA regulations, and most importantly, allows for the nursing department use. When all the research is completed, the best system is chosen, and all the current processes and systems have been fully developed, the act of putting the plan in motion begins. With the implementation of an EMR system for the athletic training and nursing departments, the perceived benefits definitely outweigh the challenges. Having improved documentation through an EMR system will help in the sharing of student medical information and recording and record keeping. Communication will be more streamlined because it will allow both parties to have access to each other's information. In regard to student and athletes' medical records, having a more centralized and accessible electronic documentation system, the quality of care provided to our students and athletes will definitely be maximized. Along with the athletic training and nursing departments, there will need to be several other individuals involved to have this quality improvement project executed. The head of school, chief financial officer, nursing department, and IT department are all necessary stakeholders in the development of the plan to implement this new EMR system. The head of school will want to know why we need this new software system, how much it will cost, and how is it going to benefit our institution as a whole. The chief financial officer is going to want to know the cost, and since she is also in charge of the nursing department, we want to know the benefits of the system to that department also. The nursing department, by developing a plan to implement this new system, they will see that documenting and sharing of medical information will be more streamlined and that it will greatly benefit them in their daily tasks. No more searching for paper physicals and medical condition lists. This will all be included in the EMR system. Having students log in as they enter the office for treatment will allow for better HIPAA, FERPA compliance, and communication with the athletic training department will be enhanced because we will have access to each other's medical documentation. Since this department is very hesitant to change and unfortunately not very computer savvy, it should be stressed that with the addition of the EMR system, their work in relation to paper documentation will decrease by having a one-click system to enter treatment information, and all storage will be done electronically, so no more clutter. This will also help in a case of a legal issue. Once all the benefits of the EMR system are addressed, they will see it is going to be much easier and more improved for them instead of more complicated. The IT department will need to help implement this new system between the athletic training and nursing departments once all other approvals have been met. This department will need to learn how the EMR software system is going to be integrated into the Spence electronic system. They will not have to train the two departments on how the system works, because this will be done by ATS personnel, but they will need to learn how the system works just in case any technical issues were to arise with our Spence computer systems. Currently, there is a new electronic student record system at the school. However, these records do not include any of the necessary medical record documentation that is needed for both the athletic training and nursing department. The EMR system for the athletic training and nursing departments will be an entirely different system than what they are currently implementing. With the IT department being extremely involved in instituting this new electronic record system at the Spence School, many setbacks have occurred, and adding another software system may not be in their foreseeable future until this current system is up and running effectively. This is the only barrier that may be anticipated. Lastly, formulating the appropriate steps necessary for attaining approvals from all the involved stakeholders just mentioned will put the final touch on the last stage of this quality improvement project. This would be the actual purchase and implementation of the EMR system. The anticipated purchase date of the EMR system would be by May or June of 2019, so that the system could be up and running by the 2019-2020 athletics school year. It is the hope that the system could be approved and purchased prior to the anticipated purchase date, but with the new student record system, there needs to be time so that everything could be up and running before this new system gets into the mix. Once purchase is complete, training would take place in August of 2019, and hopefully beginning preseason 2019. All fall sports, including soccer, field hockey, and volleyball and cross country, would begin with the new system. This table, as stated earlier, shows a comparison of the three different injury tracking systems being researched. As you can see, all three basically share the same features. However, the athletic training system was the only one to have the ability to be used by other users, for example, outreach or by our nursing department. An important lesson learned while performing this quality improvement project was that having complete and accurate patient care documentation is imperative for the measurement of quality of care. After analysis of the current medical documentation and communication processes in place at the Spence School between the athletic training and nursing department, the need to share student medical records through the use of an EMR system became evident. After having researched how EMRs can help facilitate greater quality patient care and sharing of information among different stakeholders, the process of developing a plan to implement this type of medical documentation system was implemented. There were so many EMR systems available to the healthcare field that it was quite difficult to narrow the choices down to only three. By minimizing the search to just the field of athletic training helped in the process, but the final resource for reducing the choices was to include availability of other resources such as the nursing department. One limitation encountered was setting up the approval meetings, which to this date has not have been completed. With the implementation of a new student record system at the nursing department and the IT departments were hesitant in wanting to meet to discuss this new EMR system. The nursing department is still trying to learn the new student medical record system and is having several issues with data collection and processing. The IT department is reluctant to be involved in learning a new EMR system until the current system is up and running effectively. With this quality improvement project, communication between clinicians, proper and quality documentation, sharing of patient care information between the clinician and the patient and documenting effectiveness should all be accomplished. In conclusion, at the Spence School, communication between the athletic training and nursing departments needed to be more streamlined, and both parties needed to have access to each other's information in regard to student and athletes' medical records. By following the best practice guidelines set forth for patient care documentation among medical professionals, achieving quality patient care through the use of proper documentation should be the foremost interest of all. By developing a plan to measure the importance of medical records documentation and medical record sharing among the athletic training and nursing departments, a complete evaluation of the systems and processes already in place and what, if any, changes needed to take place was performed. With the identification that the implementation of an EMR system was the right course of action to help alleviate the lack of proper student and athlete medical documentation, a plan was developed to address this issue. Research of all available EMR systems available to healthcare professionals was completed, and the appropriate choice for our institution was selected. Once all stakeholder perspectives and potential barriers and challenges with possible solutions were acquired, the final stages of the quality improvement project can proceed. The eventual goal is approval of the chosen EMR system and implementation within the institution. Once implementation is achieved by the beginning of the 2019-2020 academic year, complete medical documentation, record sharing, and communication between the two departments would become simplified with the use of this new resource. I would like to thank my advisor, Dr. Bart Anderson, for all his support and guidance throughout this quality improvement project process. I greatly appreciated all the direction you provided, and I could not have completed this without your help. I would also like to thank all the faculty and staff for these past 2.5 years. It has been a great learning experience, and I am grateful for the knowledge that has bestowed onto me. And last but not least, here are my references. Thank you.